For the purposes of this presentation, I'm going to go ahead and remove my mask. I want to talk about some fast-moving activities that are taking place today. As you may have heard, the governor has announced starting on Monday, April the 27th, we will begin to ramp up and open what we consider non-emergent and time-sensitive procedures. That means our clinic hours will begin to expand. So your physician will be reaching out to you to talk about what that looks like for you. So as the governor has mentioned, and we are echoing, you should be wearing a mask anytime you're in public. If you're not doing indirect care with a patient that potentially is COVID positive or in isolation, a cloth mask is totally appropriate. You'll see in our hospital associates that are in non-patient care areas wearing cloth masks at all times. So we're doing that as an abundance of caution to protect our personnel so that they're here to take care of you and your families as they need. But to give you an update, we continue to do community testing, but we've reduced that to 1 day a week. And the reason we reduced that to 1 day was the fact that we didn't have that many people coming through on both days. So we're averaging right now about 50 people come through 1 day a week. That will continue. It takes place at the Votex Center on Tuesdays from 10 a.m. to 12 noon. It's a fast process. It takes about 5 to 6 minutes from start to finish. You never leave your vehicle. So we're screening now. We've widened the screening, which means you don't necessarily have to have a fever any longer. If you're over the age of 65, you've been in direct contact with a COVID positive patient, you are immunocompromised. In other words, maybe you are a cancer patient, or you're on immunosuppressive therapy and or medications, you're pregnant, or you have hypertension or renal disease, you'd be a candidate for us to screen. So you can come through, one of our nurse practitioners will speak with you, and then we'll move you through testing. It's pretty quick. You get the results in about 3 days. We will continue to have the courtyard in what we consider an isolation lockdown. That means no outside visitors or guests allowed to enter the courtyard. We're doing that as an overabundance of caution to protect our most vulnerable, our seniors. So to date, this team has done an amazing job safeguarding those patients. We want to continue to do that, make sure that we have a very safe environment for them. We don't even allow outside food and clothing to be brought in. Everything is taken care of on site to make sure that we minimize any type of risk to our senior population. Again, if you have any questions or concerns, please feel free to reach out to our Facebook page and we'll try to answer those questions for you. We look forward to giving you these updates as things progress. We have been here through this trying time, and we will be here to service your needs and take care of you. As we've talked about, we're open for business and we begin to ramp up our elective and time-sensitive procedures starting on Monday, April the 27th. Thank you and have a great day. Be safe out there and make sure you always wear your mask.